Dr. Ali. Welcome back. For those of you who are joining us for the first time, please subscribe to continue being part of this healing community where we share knowledge and research that we need to heal and sustain good health. I'm a functional physician and a mindfulness coach, and my goal is to provide education and guidance to our patients, their families, as well as our community on how to achieve optimal health and wellness. Everyone has the ability to achieve optimal health by making simple, sustainable changes to our lifestyle. We can prevent and even reverse chronic disease. So let's talk about the topic for today, and that is osteoarthritis. Let's start off by looking at what is arthritis. So it's a general term for conditions that causes joint pain or stiffness. Basically, it's characterized by inflammation. When we have inflammation of a joint, be it knee joint or hip joint or the small joints of the fingers, basically we have symptoms such as pain, swelling, stiffness, and reduced range of motion. There are many different types of arthritis. I'm going to discuss three main categories. The first category is osteoarthritis. Osteoarthritis is the most common type of arthritis. It occurs when the protective cartilage that cushions the ends of our bones wears down over time, causing bones to rub against each other. The second category is autoimmune arthritis. There are many diseases which come in this arthritis. One of them is rheumatoid arthritis, where there is the immune system attacking our own tissues. The other type of arthritis, which is also autoimmune in nature, is psoriatic arthritis. And this type of arthritis affects people who have a skin condition called psoriasis. The third type of autoimmune arthritis is called ankylosing spondylitis. This type of arthritis primarily affects the spine, causing inflammation between the spinal vertebrae. It leads to chronic pain and discomfort. The third category of arthritis is basically arthritis that is caused by crystals. One example of that is gout. Gout is arthritis where there is sudden severe attack of pain, swelling, redness, and tenderness in the joint. It often affects the big toe and is caused by crystals of uric acid which accumulate in the joint. Today, we will be focusing on the most common type of arthritis called osteoarthritis. So, what are the common symptoms of osteoarthritis? Pain is one of the most common symptoms, followed by stiffness. The stiffness in osteoarthritis is less than 30 minutes, primarily in the morning. If the stiffness is over 30 minutes, then one needs to think about the possibility of an autoimmune arthritis. Our joints can also feel tender on light pressure, and there is definitely loss of flexibility. You will also hear a grating sensation or a cracking sensation when you use the joint. We often call that popping sound. And that is also an indication of osteoarthritis. There could be swelling as a result of inflammation around the joint. And you will also see that there is what we call bone spurs. These are extra bits of bone which feel like hard lumps that form around the affected joints. One can also feel weakness, which is basically reduced strength in the affected joint, leading to difficulty with tasks that you could previously do, but you can't do because of the inflammation. Of course, there is reduced function and reduced mobility of the joint. And unfortunately, if we do not take care of the inflammation, the symptoms can actually progress over time slowly, and the situation can get worse. Which would also mean that at some point in time, we often say it's the last stage where it's bone on bone, And at that point in time, it can get so debilitating that you may not be able to use that joint at all. Osteoarthritis can occur in any joint, but it most commonly affects the hands, knees, the hips, and spine. So, what are the risk factors for developing osteoarthritis? One of the most important risk factor is age. Of course, women are more likely to develop osteoarthritis than men, although we are not too sure why. A very important risk factor which can actually be reversed is obesity. Carrying extra body weight contributes to the development of inflammation in the joints. So there is a lot of additional stress on weight bearing joints, such as hips and knees. The other reason why obesity causes osteoarthritis is that um, the fat tissue produces proteins that cause increase in inflammation in and around our joints. Joint injuries are definitely risk factors for developing osteoarthritis. So, if you have played a lot of sports and have gotten injured, or you have gotten injured from an accident, these incidents and accidents will increase the risk of osteoarthritis, even if the injury has occurred many years ago and seemingly healed. It can increase your risk of osteoarthritis. Certain occupations can also increase the risk of osteoarthritis because you may have repetitive stress on a particular joint. And of course, genetics is another factor. If you have it in your family, you may be predisposed to developing osteoarthritis. So, now let's talk about arthritis in the United States. What is the prevalence of it? And so, according to Centers for Disease Control, CDC, 54 million people, about 25% of the population, have some type of arthritis. And this has a direct effect on the quality of life of the individual suffering from it. It's also the leading cause of disability in the United States. So now we're going to talk about how are we going to help somebody who has osteoarthritis using the functional medicine approach. So the first thing is going to be, because it's a disease of inflammation, we want to focus on anti-inflammatory diet. An anti-inflammatory diet is a diet which reduces inflammation, because inflammation is the root cause of osteoarthritis. So one of the most important components of this anti-inflammatory diet is non-starchy vegetables. So having 9 to 12 servings of non-starchy vegetables can really help, because these non-starchy vegetables are packed with antioxidants and nutrients which actually help reduce inflammation. The other thing which can really help in terms of the anti-inflammatory diet is healthy fats. So foods that are rich in omega-3 fatty acids like fatty fish, flax seeds, chia seeds, olive oil have anti-inflammatory properties and can definitely help with arthritis. Certain herbs and spices, such as turmeric, ginger, cinnamon, and rosemary, have been shown to have anti inflammatory properties. So, these are the components of anti inflammatory diet that you may want to focus on to help reduce the inflammation of osteoarthritis. The second thing is that flexibility exercises. So, the reason why the exercises, particularly flexibility exercises, are important is because we are trying to strengthen the muscles around the joints. So, we know that doing at least 150 minutes of moderate intensity aerobic activity on a weekly basis can certainly help us strengthen our muscles. Now, examples of aerobic activities would be walking, swimming, or cycling. Then, flexibility exercises should be performed daily to maintain joint flexibility and reduce stiffness. And examples of flexibility exercises would include yoga and Tai Chi because they help with flexibility. And another form of exercise which is also helpful in osteoarthritis is strength training. But that should be done 2 to 3 times a week. So there are three different types of exercises, but if you have osteoarthritis, then you may want to focus on flexibility more so than aerobics and strength training. The other two can also be helpful, but not as helpful as flexibility exercises for that particular joint. So we've already talked about strength training and how strength training 2 to 3 times a week will strengthen your muscles around the joints and can help you stay mobile. Nutritional supplementation. So omega-3 fatty acids is one of the very important nutrients which has been shown to have anti-inflammatory properties and can help with reducing the pain of osteoarthritis. Another very important nutrient is glucosamine in combination with chondroitin. These are compounds which are very helpful for the cartilage. And so they will help slow the degeneration or destruction of the joint cartilage in osteoarthritis, reduce pain, and improve joint function. Vitamin D is essential for bone health, and its deficiency has been linked with various types of arthritis. So it's very important to have vitamin D in your diet. Turmeric is a spice, and the active component of turmeric is curcumin, which also has anti-inflammatory properties. So this is another way you can actually help your osteoarthritis. Interestingly, mindfulness meditation is a form of meditation where individuals focus on being intensely aware of what they're sensing and feeling in the moment. And we know that mindfulness meditation has been shown to help with reducing pain in patients who have chronic joint pain. And so that is something that you can go ahead and do and help your chronic pain related to osteoarthritis. Sleep is extremely important. We know that at least 8 hours of uninterrupted sleep can significantly help people heal. We heal when we sleep. And so if you get adequate amount of sleep, it will certainly help with joint pain, stiffness, and prevent further destruction of the joint. Another important area which we know can reduce the inflammation is the gut. So we know the gut bacteria can play a very important role in reducing inflammation and autoimmune responses. And so, in order to improve your good gut bacteria, you can actually take a probiotic or you can eat probiotic foods such as yogurt, sauerkraut, kimchi, and other fermented foods. You can also eat prebiotic foods. Prebiotic foods are basically dietary fiber that feeds the beneficial bacteria. So, foods rich in prebiotics include bananas, berries, onions, garlic, and legumes. And then, very importantly, you can also avoid foods that destroy the good bacteria. So, for example, high sugar diets, and highly processed food promote inflammation and negatively affect the good bacteria. So, that is another thing you can do to help your osteoarthritis. Thank you so much for being with us today, and hopefully, we'll bring you more and new information in the coming week.